Yeah, first I would like to take this opportunity to thank FK Norway for inviting me to come and represent our partnership, and also the conference organizers for organizing this conference, inviting us to be here. Our partnership with Norway evolved back from 2009. That was when it was only 2 years after the blood service in Zanzibar and Tanzania as a whole was established under the support of the US government. At that time, the partnership was involving the whole blood service in Tanzania and Zanzibar. The aim is to build capacity through exchange of workforce and to build practical experience and skills to meet our mission of ensuring adequate and safe blood and components to the hospitals and their appropriate utilization to save lives. Our 6 years of North-South partnership between 2009 and 2015 was implemented through 6 months to 1 year rounds of exchange between Zanzibar Blood Transfusion Service and the whole nation's Blood Transfusion Service and Auckland University Hospital Blood Bank, where a total of 4 rounds were implemented, and there was a participation of 5 key technical staff from Zanzibar and 4 from Norway. This exchange was fully financially supported by FK Norway through the Department of International Collaboration of Auckland University Hospital as the coordinating partner. In order to monitor achievements, specific set of objectives and targets were agreed upon. Ladies and gentlemen, I take this opportunity to declare that our partnership successfully achieved most of the set objectives and targets over the years and contributed significantly towards strengthening our blood services. To mention a few, for Zanzibar, this includes skills and a capacity to initiate and carry on with production of blood components and pediatric units. And when we started, we couldn't. We had the machines, we had the money under the support of the US government, but the skills and capacity was still not there. So 2 years following the exchange, the capacity was built and we went full swing and into production of components, which are very important in improving the quality of health service through reduction of mortalities which could be caused because of lack of adequate and safe blood. Similarly, during the whole period, higher levels of staff commitment and enthusiasm have been observed, and over time, attained ability to smoothly work in multicultural environment, which was very important for our exchange and for the North partner who are experiencing significant change in cultural diversity. Our partnership in Auckland Blood Bank also opened up more opportunities. We had several in-country training of our clinicians on appropriate use of blood, the know-how, which was not there before this partnership was started, because the components were not produced in the country. And this also, a partnership also include sharing of expertise on ways to adapt life-saving transfusion protocols based on available resources, which seem to have worked well, and we can see a positive impact in the reduction of maternal mortality. We also jointly undertook a research on blood phenotypes, the results of which are used to improve blood group serology to avoid complications which can occur due to blood transfusion. Auckland colleagues approached Rotary Club in Norway to support construction of a satellite distribution and collection site in the second island of Pemba, which is very, very important for us in increasing the availability and adequate blood to the hospitals in the whole country. Through this partnership also, we had a new round of exchange South-South, which was developed, and this exchange involved the exchange of staff between Nepal Red Cross Service and the Zanzibar Blood Transfusion Service, again through full financial support of FK Norway. so that we learn from Nepal on how they managed to create awareness and be very successful, and having the community well accepting and are very, very willing to donate on a voluntary basis. Dear colleagues, our partnership had the following strengths that played a very big role in our success. The strong commitment of all parties in maintaining good relationship at all levels and meeting the agreed upon objectives and targets set forth for each round of exchange, willingness of the partners to share experience and expertise, full financial support by FK Norway towards the exchange of workforce and support to procure some equipment, presence of committed and efficient coordinating partner playing a big role in guiding and checking on management of FK finances and assisting in partnership logistics. During the period, there was also significant financial support from the US government, as I said, where the equipment, major equipment to produce the components and other blood service were available, and fund was also available, therefore providing for enabling environment to use the skills that could be attained. There was on-site technical assistance by American Association Blood Bank to establish a national quality department at a national level and put into place quality system. And this includes development of SOP. So with this partnership in place by AABP to initiate the quality department, it was very much complemented this exchange of workforce, whereby skills were attained and could be translated into the quality systems of the country. Working environment was also enabling in both partner institutions. There was good living conditions for participants at all partnership locations provided through FK Norway support, and staff were motivated to travel abroad. There was also smooth communication between the partners. Lack of transfusion medicine expert making us all the time dependent on North expertise for expert guidance and training our new clinicians. Uncertain sustainability of achievements, though so far we are doing very well, and the government is very supportive, providing all the necessary equipment and support to make sure that all these gained know-how and skills are being implemented to improve the health of our people and reduce mortalities, especially of women and children. Otherwise, ladies and gentlemen, I hope at this point I would like to end my presentation and thank you all for your attention, and I hope I made some contribution to the next session, supposedly, where we will come up with recommendation on how we can improve our partnerships and make them more sustainable and being equally in relation. Thank you.